Welcome back everyone, this is part 2 of our medical cost analysis project. In the last video, we used pivot table and formulas to answer key questions from the dataset. Now in this video, we are going to take it a step further by creating interactive dashboards using Excel. These dashboards will help us analyze medical cost data from the US more effectively, draw meaningful insights, and present our findings to management or higher departments for better decision making. If you are serious about your improving data analysis skills, don't forget to hit the subscribe button because I will be uploading many more practical and valuable videos like this. And if you have any doubts, feel free to drop them in the comment section. I will definitely help you understand everything clearly. So let's get started and begin building our dashboard. So guys, let's start preparing dashboards. But I just need a heading to show it more effective. Like as you see, I inserted text box from here and I just change the format like background color as yellow and the text medical cost analysis is in black, and these symbols, it's a medical cost data. So I added these shapes like by going to insert, after that illustration, shapes. In icons you can search that. In the first dashboard, I focused on analyzing medical charges based on gender. Using a pivot table, I calculated the average and total charges separately for males and females in the dataset. From the bar chart, we can clearly observe that males have slightly higher average medical expenses compared to females. This could be due to various factors such as lifestyle differences, higher BMI levels, or smoking habits, which we'll explore further in the next charts. This kind of dashboards helps management or healthcare to analyze to understand cost trends across demographics and possibly take action like targeted awareness or healthcare plans. In the second dashboard, I analyze the medical expenses based on smoking status, where yes means smoker and no means they are not a smoker. Here the difference is very clear and significant. From the bar chart, we see that smokers have much higher medical charges compared to non-smokers. In fact, the average charges for smokers are almost double or more than those for non-smokers. This tells us two important things. Smoking has a serious financial impact, not just a health concern, and it's a crucial insight for insurance companies and health policy planners to consider when pricing plans or designing wellness programs. To support this, I have also included a pie chart showing the relationship between children and charges, age and charges, and BMI and charges. Next, I created a chart to analyze the distribution of medical charges across all individuals in the dataset. From this chart, we can see that most medical charges fall below 15,000, meaning the majority of people are spending within this range. This indicates that low to moderate medical costs are most common, and only a smaller portion of individuals have very high expenses. So in this chart, I compared the data region-wise by showing two important factors side by side. Like the orange is for sum of BMI and the blue is for average of charges. This gives us a clear understanding of how region impacts both health via BMI and medical costs. From the chart, we can clearly see that the southeast region stands out. It has the highest average BMI and as well as the highest average medical charges compared to the other regions. This suggests that people in the southeast may have more health related issues, possibly due to lifestyle or environmental factors, which is resulting in higher medical expenses and BMI also. So it's also the same chart but only for the average charges by the region, so we don't need to understand that. So in this chart shows medical charges categorized by both region and smoking status, helping us analyze how smoking impacts healthcare costs across different parts of the country. So in this chart, we have separated data for smokers and non-smokers with each region. This gives us a comparative view of how much each group is spending on medical charges. From the chart, we can clearly observe that among smokers, people in the southeast region have the highest medical expenses, and among the non-smokers, the northeast region has the highest average charges compared to other regions. This kind of multi-level breakdown is extremely useful in data analysis. It helps us understand not just how smoking affects medical costs, but also how that impact varies by location, which is very important for healthcare planning, insurance pricing, and targeted health awareness programs. So next I created an area chart that shows how medical charges vary with age. From this chart we can clearly see a trend. Before the age of 30, medical expenses are generally lower. As age increases, the charges gradually rise, which is expected as older individuals often require more medical attention. Most importantly, after the age of around 58 to 64, the expenses rise sharply, indicating higher healthcare needs in that age group. This chart is very useful in understanding how age impacts medical spending, and it can help hospitals, insurance companies, and policymakers in designing age-specific health plans for providing support for senior citizens who may face higher medical costs. After creating all the main charts, I added slicers for three important categories like for region, smoker, and for sex. These slicers allow us to interactively filter the data and view the charts according to our specific requirement. For example, we can now instantly check medical expenses of smokers in the southeast like this. It changes for southeast like this. It is for the southeast for smokers. For male or female also we can check. It's changing according to our requirement. For northeast, for southwest, southeast, northwest, the data is also changing for male or female. Okay, so we can reset the slicers also. Okay, or compare male versus female charges in the northeast, or even see how non-smokers across different regions are spending. Using slicers makes the dashboard more dynamic and insightful, and it helps us present clear and customized view to management or clients based on their specific regions. So that's it for the video. I have created this chart based on my own analysis and understanding of the data. But remember, as a data analyst, it's your responsibility to explore the data and decide what visuals best represent the insights. The goal is always to help with better decision making and to make the data easy to understand for management or clients. Once you complete this kind of project, you can definitely add it to your resume or portfolio. Projects like this show your ability to work with tools like Excel, apply formulas, use pivot table, and interactive dashboards, and most importantly, extract valuable insights from the data. If you have any doubts, feel free to ask in the comments. I will be happy to help. Don't forget to like, share, and subscribe to the channel for more real-world data analysis projects that will help you improve your skills step by step. So let's meet in the next video, guys.